And today the first question is about constipation. Yes, so the constipation word means difficulty in passing the toilet, or the medically in the definition when we talk about this, it is like absolute stoppage of the fecus and even the flatulence through the anus for minimum of 4 days, then only it is termed as the constipation. Okay, the medically terminology, when we talk about the definition, it is the absolute stoppage. The anus should be totally closed, where you are not even passing the air. Forget about the toilet, even air is not passed through the anus, then only it is called as the constipation. Okay, but in a normal terminology, I think the question was asked about not passing or not clearing the toilet every day and not being comfortable in evacuating it. Sometimes it may be hard, or sometimes it is stopped but it feels it is not yet cleared completely. Sometimes you will not get the urge, and most of the time it will not be cleared on the early morning, like as soon as you get up. Sometimes it will take like in the afternoon, evening, or maybe soon after the food you have to run for the bathroom, these kind of the things. So nowadays all these situations will be termed as the constipation in a general, these things.
Morning cup of joe.
Yeah, some people will have the addiction to the coffee, then only they will pass the toilet. Some people will have the addiction for the tobacco or the cigarettes, after that only they will pass the toilet. Yes, so we will talk about these things today. So basically, before understanding the constipation, we will talk about the digestion process, like how a normal toilet is formed, how the normal stool or the normal this excretion mechanism, how it works in our body. Basically, when you eat the food, any food, when you are eating, that food will go into the contact of the digestive fire, Jata Ragni. In the fire, do you even know, when we talk about the fire or the digestive fire, that is not the only fire in our body. We have 13 kinds of the fire in our body. One is Jataragni, and the remaining 7 are Sapta Dhatwagni. Sapta Dhatu, 7 types of the Dhatu Agnis, the fire which is situated in the Dhatu level. And Pancha Bhutagni, 5 kinds of the Agni which are situated in the Bhuta, Pancha Mahabhutas, and one is Jataragni. So all together there are 13 kinds of the Agni. So the food what you eat first, and that first comes in contact with the Jataragni, and Jataragni boils that food, cooks that food, like it's like a little kitchen inside. Whatever you cook in the kitchen is just to facilitate the cooking here. It is like you are helping your Agni by cooking something in a different way and different methodologies. And do you even know when does the exact digestion process starts? Any guesses? When the digestion starts?
In the mouth.
Yes, when the food comes in contact with the saliva. The moment food comes in contact with the saliva, the digestion process starts. That's why in Ayurveda, when we are talking about the meats and all, according to Ayurveda, drinking the juice and the liquid food is not light. That is hard for the digestion, because that will sometimes surpass the contact with the saliva when you drink it directly that way. That's why it is difficult for this system to digest it. And in another context, Ayurveda also says that you need to make sure that food is coming with the contact of the saliva completely. Like the food what you are eating, that has to be totally soaked in that saliva. Why? Because saliva is like the cleaning agent. Saliva is like the cleaning agent. It cleans the food. Just like the way you can imagine your kitchen, where you bring the vegetables, you wash it and you cook it, and then you prepare the final dish. Similarly, in our body, when you eat anything, firstly your mouth, the saliva washes it. Only after the proper wash, it enters inside, and then it comes in the contact of the Jataragni. There it again cooking process starts. It cooks the food.
Is that the process, oxidation?
Yes, oxidation is not only that process. Oxidation happens in the different level in our GI tract. It happens in the different levels of the interaction, the food interaction with the enzymes. Okay, that is not the oxidation only, because oxidation happens in multiple levels, not only in one particular part of the digestion. Okay, so food is washed properly, it goes inside, then the Jataragni makes it cook completely, and then after it goes into the contact of the next intestine, then what happens in between this, so many other little things are happening, and which are very much essential with all the different enzymes which make your absorption level maximum. Okay, without the proper contact of the enzymes, the absorption mechanism will not be proper. So then what happens when it goes into the intestine, then the maximum absorption of the nutrients happens in that part, and from there it goes to different level of the dhatus. Like from the Jataragni, the food, what is Sara Bhaga, the essence of the nourishment part will be absorbed as the Sara Bhaga, and that Sara Bhaga will be coming into contact with the Rasa Dhatvagni. Rasa Dhatvagni is the metabolic fire which is responsible for the preparation of the Rasa Dhatu. Is the first basic dhatu in our body.
What is dhatu?
Dhatu is the basic body building materials with which your body is made up of. There are 7 basic factors with which your body is made up of. That is called as the dhatus. So for example, when we are talking about the rasa, rasa is the all the liquid portion of your body is called as the rasa dhatu. Hormones are rasa dhatu, and all the interstitial fluids are rasa dhatu, and even the essence of the food what is absorbed from your gut, that is also rasa dhatu. So all the liquid content and the essence of the food what you are eating, that is called as the rasa dhatu. Briefly telling, okay. Superficially when we talk about, these are all are related to rasa dhatu, and from the rasa dhatu agni, then it comes in contact with the rakta dhatu agni to convert those nourishment into rakta dhatu agni. Rakta, the blood cells are formed only when the rasa dhatu formation is proper. It cannot jump and surpass the chain. It cannot directly, when you take the calcium tablet, it cannot directly jump into the absorption of the bone. It has to pass through the rasa dhatu, rakta dhatu, mamsa dhatu, then this sequence has to be followed. That's why the treatment of the infertility sometimes becomes very tricky, because that is related to shukra dhatu, the 7th dhatu. That's why the treatment of the infertility is always feels tricky, because you, without correction of the previous 6 dhatus, you cannot directly jump into the correction of the 7th dhatu. Okay, so this is about the dhatu absorption, that we will talk in detail again when while answering your question. So now we are in the topic of the constipation, where Sara Bhaga and the Kitta Bhaga has been separated. This Sara Bhaga goes for this Dhatvagni formation and the Dhatu formation, Bhutagni contact to make sure the balance in the Pancha Mahabhutas in your body, and then this Kitta Bhaga goes for the excretion. But even with that, what happens? Whatever the mala, there are 3 malas, Sweda, Mala, Mutra, that is sweat, toilet and the urine. So these are the 3 malas in our body. So after bifurcation of the Sara Bhaga and the Kitta Bhaga, this Kitta Bhaga will be divided into Mala, Mutra and Sweda. And last part of the colon, last part of the large intestine, it does the work where it will recheck whether any of the nourishment has been gone for the excretion. So that's why when you don't pass the toilet for 1 day, 2 day or 3 days, you see that day by day it is becoming more and more hard. Why? Because the more time, the more duration it is staying in the large intestine, the last part of the colon, the villi in that part is continuously absorbing the water from that excreta, thinking that some of the nourishment have been disposed, thinking that it will be reabsorbed, because at the last part of the colon only two things happen. One is excretion of the any remaining the residual toxins. If there is, it's like you are giving that trash to the municipality van every day, and even before, at last before giving, mother comes and checks, oh, you did not add this only, even I had to throw this, and she will give some extra things to throw it away. And also she will check, अरे ये तो इतना अच्छा था, इसने क्यों why did you throw this away, because this is very good, this I wanted, and she will take some of the things back. The same way the large intestine, the last part of the colon does this job, absorption and secretion. Absorption of the nourishment if something has been gone into the excreta part, and also secretion of the toxins if any of the toxins or the residual part of the toxins have been left in the process of the digestion. So this absorption and secretion will be happening in the last part. So what happens in this time? Because of so many reasons, because your constipation is not just related to the fiber content in your food. For those who have already experienced constipation, you might notice that even on the day when you are eating good, even on the day when you are not eating good, even on the day when you are having enough vegetables, even on the day when you are not having enough vegetables, there are chances that you may encounter this hard toilet or difficulty in passing of the toilet, or feeling of the incomplete evacuation of the toilet, because the mala visarjana or the excretion mechanism not only depends on your food ingredient. Definitely ingredients of your food play a major role in deciding how should be the excretion mechanism, but that is not the only role, or that is not the only reason for your proper excretion mechanism. Mainly this excretion mechanism, surprisingly, it is connected to your emotions. Just like the way you calculate your food and the portions of the carbohydrate, proteins, fibers and all these things, also you need to calculate the emotions what you had on the previous day. There are high chances, that's why gut is also called as the gut brain. Have you heard of this word, gut brain? Why? Because the nervous connections to the gut is so important that it acts as another brain. This is another brain in your body. So what happens when you are emotionally disturbed, or when your emotions are too much fluctuating, then also you can see the changes in this excretional mechanism. You might have noticed when you have to give an interview, or just before the day of the exam, we tend to pass the toilet easily, or even I have seen some people who will not even have the breakfast and all, because oh, now today we have exam, if I eat something, I had to run to the toilet, so today I will skip my breakfast and I will go to this thing. Because what happens, because of the stress what they are having on the day of the exam, even if they are eating, their gut is not working. It just throws it away as it is. And on the days when we are very sad, when we have lost someone close to us, or something bad incident has happened with our life, that day also your gut will not work. You will not feel hungry, you will not feel like passing anything. You will be totally observing that stillness in your gut, because your gut is directly related to your emotions. And the third thing, which is related to your daily routines kind of the thing. For example, Ayurveda says that there are 13 Vegas which should not be avoided. Like there are 13 things which should not be avoided. Those Vegas, for example, sneezing, for example, the toilet, or holding the urine, or holding the toilet for long time. Most of the people will do that because of the responsibilities, profession, or meetings, whatever it is. When you are getting the sensation of the urination but you are holding it, when you feel like sneezing but you think it is inappropriate in the public and you try to hold it, You are feeling that cough, but you are holding it, you are avoiding the cough. These are called as the Vega Dharana. Vega is the natural urges when they are suppressed. That also leads to constipation. That also leads to constipation or the disturbance in your gut health. So Ayurveda says you should never ever hold or suppress your natural urges. Whenever you are having that time, you have to make sure that you plan your day in such a way that you are not holding your natural urges for longer duration, because that also impacts your gut health. So mainly the constipation, why it happens? One thing, major thing is about your food ingredient. If it is lacking in the fiber content, if there are no vegetables, no adequate vegetables in your thing, then it may be seen. And second thing is, second major part is the emotions. When you are going through the extreme happiness, extreme sadness, extreme disturbed emotions, or any sort of the good or bad, when you are in that extreme range of the emotions, your gut health or the gut working mechanism will be changed. And the third thing is this suppression of the natural urges. Even the nidra. We may say that I don't get it, but why you don't get it? There is some reason for that. So for all these natural urges, when you suppress, there are high chances that you have this constipation. So when you are dealing with the constipation, when you want to take the treatment for the constipation, first basic thing what you can change is change your food. Change your food and make sure that you are adding adequate amount of the vegetable, that too specifically boiled vegetables in your food. And the secondly, check the combination of your emotions, what you had on the previous day. If there is a lot of fear, a lot of anger, a lot of hatredness, a lot of insecure feeling, or whatever it is, it could be any emotions. So think and try to deal with that emotions in much better way. Work on that emotions and try to work on rectifying or dealing those emotions and the challenges in upcoming days in a much better way. Like much better way means without getting too much disturbed with those emotions. That's the second option. And the third option is just check whether if you are suppressing any of the natural urges. If yes, then try to correct it. So by doing these three things, you can see that your gut health becomes much better, and that even the excreta of the toilet becomes much easier and much comfortable without any effort or without any discomfort. And even after changing all these things, if you are not seeing any changes, then you can consult the doctor to get it diagnosed, like what may be the reason for it and how I can receive the help with some of the medications. There are so many medications. It is not just the Triphala all the time. There are much more options in Ayurveda for clearing the toilet which is accumulated in your body. So consult the doctor. Let the doctor decide which medicine is good for you. You don't have to try and experiment all these fates of that, this and all on yourself. Let the doctor decide what is the best ingredient for your symptom. And even with that, if you are not seeing any result, then you can go for the Panchakarma. In the Panchakarma, Vamana, Virechana, Basti, Nasya, Rakta, Mokshana, there are 5 therapies, and in these 5 therapies, which one will be more useful for your condition, that will be decided by the doctor. And most of the time, if it is dealing with the constipation, then Vamana, Virechana and the Basti, among these 3, there are high chances that doctor will select any one among these 3. And even this, what happens, not every time the single sitting of the therapy will be sufficient, because again, when it comes to the gut health, as I told you, it has the impact of your food, it has the impact of your emotions, it has the impact of suppression of the natural urges. So all these 3 things are not stable every day. It's a highly variable. Even though you are willing to keep it stable, it is not stable. It is highly variable 3 contents which has the impact on your gut. That's why when we are doing the correction of your gut health, when we are doing the correction of this excretion mechanism, then in some people, if it is initially like just started within 1 month, 2 months, 3 months, then just one sitting of the Panchakarma will be enough to correct it permanently. But if it is more than 6 months, let's say 1 year, 2 year, 10 year, 20 year, from these many years if you are suffering with these things, then there are high chances that your body will require the repeated sessions of the Panchakarma. And that may also vary, like sometimes initial sitting he may advise you the Vamana, and then he may advise you the Virechana. Or in the first sitting you will be given the Virechana and the Basti, and then in the next sitting when doctor is advising, they will plan only Virechana or only Basti. This way the combination and the selection of the Panchakarma will be strictly done on the customized way, based on the need for your body, based on the condition of your body. That will be decided like how it has to be planned, and that will be decided after at least 30 to 90 days of the first therapy. After when we see that how your body is changing and evolving with the result of the first course of the Panchakarma, then the doctor will decide, and for the decision he may take 30 days or 90 days of the time to observe, to understand like what's happening in your body and how your body is responding to the therapy which is taken earlier. So in general, if I have to say, work on your food, work on your emotions, and work on the natural urges. If not, then talk to the doctor. Even with the medicines, if it is not getting clear, then go for the Panchakarma. And in the one single Panchakarma or the 2 or the 3, that depends, because when we are talking about the constipation, it also depends, like constipation with what. For example, one person may be having the constipation along with the hypothyroidism. Another person may be having the constipation with obesity. Another person may come with the constipation and the diabetes. Again, diabetic is a metabolic syndrome. And another person may be there who is having the constipation with the hypertension, high blood pressure. There may be another person who is having constipation with the psoriasis. So depending on the combination of the constipation with other health issues in your body, constipation with the neck pain, constipation with the low back pain, constipation with the hair fall, constipation combined with the multiple problems in your body, then also the treatment modality changes. Because when we are planning for the treatment, it will be as a whole, like we will consider your body as a whole. Then depending on this condition, okay, this lady who is having this constipation and let's say the diabetic, so the combination and the planning of the therapy will be different for her condition. If there is another guy who is having the constipation and with the loss of weight, he may be emaciated, he may be eager to gain weight but not able to gain weight. In that condition also Panchakarma will be decided, but in a different way. And in that condition, after the Panchakarma, he will be gaining the weight. It is planned in such a way that, because most of the people think that Panchakarma is for the weight loss, but not really. Panchakarma can be even planned for those who want to gain weight. That is in the hands of the doctor, how he has to plan and how we have to decide and design the treatment protocol. That's why we always say that just surrender to the doctor and follow what the doctor advises, because it is totally in the hands of the doctor to design and to plan the therapy and the medications according to your body need. After the Nadi Pariksha, once we understand that what are the proportions of the doshas and what are the distribution of the symptoms in your body, based on that this will be decided. So basically constipation means look at your plate, look at your emotions, and correction of the suppression of natural urges. These are the basic thing, and most of the problems will be running around this itself. So when we correct it, most of the time it becomes normal.
So is it that, so what is the combination of constipation with acidity or gas or bloating and all these things, and does water enema help in general?
Water enema is not basically from the principle of Ayurveda. Water enema is used in the principles of the naturopathy. Again, naturopathy and Ayurveda are totally two different branches, two different sciences. They are having so much of the difference of opinion in multiple principles. We focus on the Tridosha Siddhanta and they focus on the Pancha Mahabhuta Siddhanta. Even though both are natural medications, but the distribution of the principles is totally different. And and according to the principles of the Ayurveda, water enema is not suggested because water enema, this kind of the thing, is not suitable in this condition where Ayurveda tells about the Sneha Basti, Matra Basti, Kala Basti, Yapana Basti, Niroha Basti, Kashaya Basti or Yukta Rata Basti. There are multiple ways of the Basti or the multiple combination of the Basti Chikitsa explained, which is having more combination of the medications into the Basti medications, yeah. But here the water enema or the water this thing, it is not from the Ayurveda principles, it's from the naturopathy principles. So Ayurveda principles tells you to go for these courses and to have these kind of the medications. Yeah. Any questions from constipation? Any doubts?
I don't know if this is part of Ayurveda, but there was one person that we had consulted together long back, and they said it's also about mindful eating, the three things that you said about plate and everything. So if you're not in the present while you're eating, that also causes...
Yeah, that again falls under the emotion part only. So what you are eating, it's also like eating the emotions of every day I'm eating the emotion of anger, hatredness, jealousy, insecurity, fear, whatever it is, and all these things also has the impact in your digestion. That is for 100% sure that is there. The ingredient and the emotions and the urges, natural urges. These three things are the main basic pillars for proper metabolism and proper excretion mechanism. When you work on these three things, then you will see the sustainable result. When you only work on your food, you will see the change for 1 day, 2 days, again the same thing repeats. When you work only on your emotions, you see that, oh, I'm feeling good today, I'm passing the toilet and I'm clear. But again on the next day, you will see some changes in your this thing. When you work only on the suppression of the natural urges, then also you will see only part of the recovery. But when you complete all the three reasons and approach, when it is including the focus on all three aspects of these reasons, then it works. Because Ayurveda tells for any problem, Nidana Parivarjana, that is Nidana means the causative factor. For any problem, for any health issues, Nidana Parivarjana, the avoiding the causative factor is the first treatment principle in Ayurveda. For example, if like I am suppressing my sleep and that is giving me some symptoms, no matter how many medications I try, no matter how many therapies I take, unless and until I change this causative factor, I cannot get the permanent cure for that problem. Nidana Parivarjana is the first and foremost treatment principle in Ayurveda for every problem. For every problem, Nidana Parivarjana has to be done. That is Parivarjana, like avoiding, sacrificing the things which is the reason for your problem.
I just have one follow-up. Sorry, go ahead.
One related question.
Sure, please.
So, some of the doctors, I mean, be it in English or any other, they suggest to walk after food, and some of them suggest do not walk because you're interrupting the digestive system from starting its work. But if you some of them say if you walk, that's when your digestive system is activating.
Yeah,
So
Ayurveda has the beautiful answer for it. Like Ayurveda tells, like soon after the food, you should walk for 100 steps. But soon after the food, doing the vyayama, like walking as an exercise, it is not advisable from Ayurveda. Ayurveda also says like doing the exercise or the vyayama soon after the food intake will even lead to Kushta Roga, will even lead to the skin diseases. So walking, it depends on how much you are walking. Shatapata, if you are walking for 100 steps, that is good for you. If you are walking for 2 kilometers, that is bad for you. So,
How much gap between eating and walking then?
so when you eat, you walk for 100 steps and then you rest. Otherwise, if you walk like in terms of the exercise, in terms of the walking as the exercise, then you have to wait at least for 4 hours for complete digestion and assimilation of the food what you have taken. Bhojanantara Vyayama has been given as the causative factor for most of the problems, and skin problem is one among them. Skin problem is one among them, where when he lists out the things which may be the causative factor for this diagnosis, in multiple contexts we receive this as Bhojanantara Vyayama. Even the rheumatoid arthritis, Bhojanantara Vyayama even may cause rheumatoid arthritis, which is an autoimmune disorder. Psoriasis is an autoimmune disorder. So it is going to disturb and abrupt your immune system to work against you. That's why doing anything like a exercise soon after the food intake is definitely not supported even by Ayurveda, and eating and sleeping is also not advised by Ayurveda. Ayurveda tells like eat, wash your hands, walk for 100 steps, okay, then you can relax for 40 minutes, 30 minutes, 20 minutes based on the need of your body. You can relax, but you should not sleep. Yeah.
So someone who is like maybe just as a like, I mean, we eat out or something, or we eat at home and then we have to go somewhere. So
you have to plan your day in such a way that you are not exhausting your body soon after the food intake. You have to plan it in such a way. Otherwise, you have to compromise with the food what you are taking. Do not have it like a full meal. Just have something which is very light on your belly, and it's not like a full meal and you are going. Yeah, you wanted us. Yeah. So the water intake and the constipation or the digestion is, yes, it's a wonderful combination, because water intake also has the impact on the digestion mechanism, a larger impact on the digestion mechanism. But here, when we talk about how much of the water we have to drink, it is not same for all of you. For one person, we may even say that drink less than 1 liter of the water in a day. We will say that do not drink much of the water. You drink very less, the whole, including all the liquid food what you are taking, all together it should be less than 1 liter. And in one person we may suggest that 2 liter, 3 liter, 4 liter, whatever it is. But basically how to plan the water intake is, the water should be taken from your body whenever you feel thirsty, because Jirna Ahara Lakshana, as I told you in the previous class, Jirna Ahara Lakshana, that is the symptoms what you observe when you have the complete digestion in your body. That is Jirna Ahara Lakshana. It says Udgara Shuddhi Rutsaha Vegotsarga Tataivacha Laguta Kshut Pipasa Cha Jirna Aharasya Lakshanam. So in that Kshut and Pipasa, hunger and the thirst is also one of the main symptom what you will observe after the digestion of the previous meal. So whenever you feel thirsty, whenever your body is in need of the water, you have to keep irrigating your system, just like the drip irrigation. Slowly, little water, drinking in every 30 minutes, 40 minutes or 1 hour or 1.5 hours, depending on the body need and depending on the physical activity what you are doing in a daily basis. Based on that, you can make sure that you are drinking the water like that, and that may be resulting into 2 liter water consumption or 4 liter water consumption. That again depends on the physical activity of a person and also the climatic condition of a person where he is staying in, like in which particular geographical area the person stays in. So depending on that, the water intake must vary. And when to consume the water? This is a beautiful question, and most of the time it is practiced wrongly, and that is also impacting our system. Ayurveda has a beautiful reference of the shloka which says Ajirne bheshajam vari Jirne varim balapradam Bhojane cha amritam vari Bhojanante vishapradam. That means when you are having ajirna means indigestion. When you are having the problem of ajirna, bheshajam vari, water itself is the medicine. Why? because already your body is in the state of indigestion. Then how can you expect that the medicines what you are having is getting digested? Nothing can get digested when you are already having the indigestion. So in the condition of the indigestion, water, that too specifically warm water or the hot water itself is the medicine. You have to do the fasting, wait for it to settle down and keep drinking the hot water sip by sip, very little amount, sip by sip, to support your system where that indigestion will be cleared. Ajirne bheshajam varim. Jirne varim balapradam. As I told you, jirne, like after the complete digestion of the previous meal. Jirne varim balapradam. When this kshut pipasa, all these things starts, then if you drink the water, that is balapradam, that will enhance the stamina, that will give you a better energy, that will make sure that you are active and energetic throughout the day. So jirne varim balapradam. After the proper digestion of the previous meal, if you take the water, that is better to improve the strength and the stamina in your body. Then says bhojanecha amritam vari. Bhojana, when you are consuming the food, if you are drinking the water sip by sip, that is equal to amrita, nectar. Bhojanecha amritam vari. When you are eating the food without drinking water, because most of the time I see even the parents telling, when the kids are asking, amma water, and no water, eat first, finish first, and then we will give them the glass full of the water. But according to the principles of Ayurveda, it is totally wrong, where water has to be given along with the food sip by sip. It's not like, okay, I'm eating and drinking a glass of water, not like that. But to facilitate the better digestion, you have to drink sip by sip water along with the food. That is equal to nectar, equal to amrita. Bhojanante vishapradam. If you drink a huge amount of water soon after the food, that is equal to poison. Bhojanante vishapradam. That is equal to the poison. That is like a daily dose of slow poison what you are taking with your own hands. So that's why the timing, proper timing of the water intake is depending on this. Whenever you feel thirsty.
Early morning. What about early morning?
Yeah, early morning, it's called as the Ushapana, and there are many people who are a huge fan of the Ushapana. But in Ayurveda, the main samhitas, Charaka Samhita, Sushruta Samhita, or even the Ashtanga, which are called as the Brahatrayis, which are called as the main three textbooks of Ayurveda, will never explain anything related to Ushapana. Ushapana is the word what personally, like, yeah, if anybody who is more scholar and have any few references, any new references, can definitely let me know. But as per my knowledge, I have received this reference only in the later period of the Samhitas, where the Nighantukaras, like after the main period of Brahatrayi, then the Lagutrayi has been come, and even after the Lagutrayi, Nighantukaras had made different textbooks, just like the way now we have the different textbook from the different authors. So this Nighantukaras explains about the Ushapana, like drinking the Anjali, Ashta Anjali, like 8 Anjali of the water in the early morning as the Ushapana. But that is Panchakarmina Shuddhina Deham. That shloka of the Ushapana, when we see the textual reference, that goes like this: Panchakarmina Shuddhina Deham. That Ushapana has to be done in a person who has cleansed his body with the Panchakarma. That word tells that it is a prescription, it is not a general practice which should be done by everyone. When you have cleansed your system with the Panchakarma, and your doctor, when he has prescribed you to do this, then only it has to be practiced. It is not a practice just like the way we brush our teeth, just like the way we do our daily routine habits. It is not something that has to be practiced by everyone, because as I told you, there are 13 Agnis in our body. It is just like pouring the liter of water into Yajna Kunda. What happens in the fireplace if I throw a bucket full of water and then fire is put off, and already I am suffering with the problems of the Mandagni or the disturbed Agni in my system, and over that somebody says somewhere that it is good to drink a liter of water every day, and even without analyzing whether it is good for me or not, or even without getting any prescription from any doctor, just by myself I start it, then it is definitely going to give you problems in the long run. You may see some changes on the initial few days. You may feel better with these things initial few days, but definitely that is not going to give you a sustainable and long lasting results, and definitely that is going to impact your gut health as well, because it is not good. And even there are some people who are practicing it that even without brushing your teeth you have to drink the water. But please let me ask you one question, like, okay, we can consider drinking the water without brushing and all these things, because even the animals are having their food directly that way, they are not brushing. But what if you have dental caries? What if you have so much of the infections in your oral cavity? What if when you have the gum bleeding? What if when you are having the problems with your tooth or the gum or the inner mucosa? When you are drinking the water without brushing your teeth, what happens? It goes inside. The infection is directly entering into your system. That makes your immunity much worse. Even in the main textbooks of the Charaka Samhita, Ashtanga Hridaya and the Sushruta Samhita, when we see the Dinacharya where start from the time of the morning, at what time we have to get up, he explained each and everything. In that what he tells, Brahmi muhurte uttishtet swasto rakshartam ayushah kratashaucha vidistasya. See, he tells, he is not mentioning about Ushapana here. He tells Brahmi muhurte uttishtet swasto rakshartam ayushah. You have to get up at the time of Brahmi muhurta, that is minimum 45 minutes before the sunrise. Then that will protect your swastha, the health. And then he says krata shaucha vidistasya. You have to clear your shaucha vidis, clearing of the urine, toilet, passing these things, and the danta dhavana. Danta dhavana is explained in Samhitas in the textbook, not Ushapana.
But Usha, like drinking water or at least hot water also in the morning, like it's like, okay, if it is not clearing, then drink hot water or warm water and then to help evacuate.
Yeah, these are all the things like to help you for the evacuation. It is just like the way I have given the example of drinking the tea for some people, drinking the coffee for some people, or having the tobacco or the cigarettes for some people. It is all, these are the practices which we have created. And in a healthy person, you don't need any of them. You will pass the toilet by your own without any these external support when you are healthy. And when you are not healthy, already you are having the illness in your body, then experimenting with all these things to create a new habit, to create some new symptoms, I think that is not logically correct to experiment with your body. When you are already ill, just go to the doctor whom you can rely upon or whom you can trust, and just surrender to the instructions given by the doctor. If the doctor himself is suggesting this to you, then do it. I have no problem with that. I am not talking against any prescription of the doctor. If the doctor is knowing your body, he is knowing the condition, what you are going through, and after analyzing your condition completely, if he is suggesting do this, then definitely do this. I am not against any prescription. But if at all, just by reading somewhere, just by seeing somewhere, if you are trying to do the experiment on your body, then definitely that is not the good practice to inculcate. That definitely I don't support. So this Ushapana habit, Ushapana has to be a prescription. Then only it has to be done. Otherwise, Ushapana, or that too, that also depends like at what time you are doing it. You are getting up at 10 o'clock and you are drinking a liter of water. That is not even Ushapana. Usha itself is relating to sun.
Sunrise.
The Ushapana has to be done before the sunrise. Even before the sunrise, you have to get up, do the sun salutation, do all these things, and that Anjali, the water has to be taken. In those days, it used to be the water from the natural, these things, and now again, the water we are drinking, that's also different. It is not the same water what we used to get it. So there are so many influencing factors on these things. So definitely, I personally don't suggest Ushapana unless and until it is a prescription to you. Yeah.
Directly we can eat the breakfast.
Yes, you have to eat the breakfast directly, because breakfast, the word meaning itself is breaking the fast. You are drinking a liter of water, then you are having the nuts, then you are having the fruits, then you are having a smoothie, then you are having ABC juice, and after that breakfast. What is that for? Why it is even called as breakfast when you have already taken list of the different things? And even I have not given the number for the tea, coffee, biscuit and all. That is one of the universal thing nowadays. Bed tea, bed coffee, what and all you need to make yourself a better visitor for the hospitals. You are doing everything which is required to make you a patient. And when I suggest something which will make you healthy and which will keep you away from the hospitals, you have list of questions. Doctor, is it safe? It doesn't have any side effect, right? Then that's what I always say, that when you are taking the suggestions from nowhere, you don't even know whether the person who is having any medical degree, this thing, you don't know anything. It could be even just the lady in the next door. You will just follow that instruction so faithfully, just because someone in the next door told you. But when it comes to, it could be even the WhatsApp forward. You will surrender to that forward message so much. But the doctor sitting next to you, who has done his degree for 5.5 years, master degree for 3 years, and done the clinical practice for 10 years, and doing the consultation for you minimum 30, 40, 50 minutes, that God knows how much time you will take. Even after all those discussion, your question will be, is it safe? No. It has no side effect? No. What does that mean? What does that mean? Do you think that a doctor who has spoke to you for so long, he will still suggest something which is not safe to you? And in the mouth you will say, oh, I trust you completely. Then why this question? Why this question? Do you really think that logically it is correct? One way you are telling that I trust you completely, and another way you are asking, is it safe? No. I know, I understand your feelings, I understand the the fear and the problems what you are going through. But still, it's again, what we say and what we feel are always different. You will be saying that I trust you, but you will not be feeling it completely. It will take years together to build that complete faith, to build and to feel that complete faith. It will take years together. But when it is just a WhatsApp forward, instantly it happens. I don't know how. This is the mentality of us. Instantly happens. You will feel and you will connect to that forward message more than your own doctor.
Related question. We were speaking about water, but we also spoke about the Nalikai the other day, right? The mountain. So, having Nalikai in a way that it is mixed with water and you put whatever other ingredients.
That is, all those things comes under the alkaline water. Alkaline water is a new concept where, not even new concept, even in Ayurveda it has. So alkaline water is like by adding, maybe some people add the carrot slices, some people add the cucumber slices, or some people are adding this ginger, and some people are adding this amla and all these things, or even sometimes some of the bhasmas. When you add certain bhasma to the water and drink it, so these are all the things which may change the quality of the water. And that aids in the digestion mechanism. That's how it is helpful. So when you are not sure about the quality of the water you are receiving, by doing all these things, it makes the water alkaline. And then when you are suffering with a lot of acidity and all these things, it's like the symptomatic support. For that moment, it gives you a support, this alkaline water, because it has the opposite quality.
But having it first thing in the morning before having...
Yeah, that definitely, according to the principles of Ayurveda, I don't support that. No.
throw some light on Dinacharya and Ritucharya, please?
Yeah, definitely we can have it's like it requires a series of the classes because that's a huge topic, huge topic, but yes, yet very important topic. Yeah, we can try to make a series on that maybe, because now I just spoke something related to Dinacharya in this context, which is related to this topic. But yes, in detail, if we have to talk, that's maybe a series. We can make a web series of 20 episodes or 30 episodes just on Dinacharya. It's such a huge and very significant and very beautiful topic to cover. I would love to do that. Let's see when it is possible. I'll do that. Anything else related to constipation?
So can I ask, so if someone is going through a phase of difficulty or exams or whatever, then it's like whatever emotions you have, like even if you're eating proper food, your emotions are causing stress that is affecting your constipation, then there'll be other things also, gas, bloating, whatever, that will further affect the mind and preparation and increase the stress. So it becomes like a vicious circle. So the more you try to kind of relax, it's like the body also is not helping you, it's kind of working against you. So then it, like, how do you break?
Yeah, you break it by taking the break. By taking the break from all those responsibilities and the commitment, because for any commitment like the exams or any difficult time in our life, if we have encountered that situation, it is not created overnight. Definitely that situation has not created overnight. It has taken so many days, months, or sometimes years together to come to that stage of the imbalance of the physical or the emotional status. So that status, just because I have the exam tomorrow itself, I cannot say that I should find some reason to clear it today itself because I have exam tomorrow and I have to focus on it. So now it is at this peak level where you have to take the break and heal your system inside out and then prepare yourself starting from zero. That has to be planned. That is the taking the break is the only answer to break that vicious cycle. There is no shortcut. There is no shortcut for the health. That's why you cannot buy health. That's why even if you are a crorepati, you cannot buy health, because health never has a shortcut. It is handmade. It is handmade for each one of you. Without your intention, without your effort, without your real willingness to heal yourself, you cannot buy health. Because sometimes what happens, most of the people, they find the comfort zone in the diagnosis. For example, a lady who is having certain problem, she unknowingly falls into that trap or the vicious cycle, thinking that, oh, now I am diagnosed with some grave diagnosis, and because of that everybody is in the family is at least asking me, how are you? And my husband, who had never time for myself, now he is like taking me to this hospital, that hospital, here, there, and all the places. So every morning and evening my kids are asking me, Amma, have you taken the medicines? How are you doing? And all these things. So these things, even though it is like really painful and like not really a good thing to expect, but unknowingly in the subconscious mind, that lady will be finding that comfort in the diagnosis. She is like, oh God, at least with this diagnosis, these people are, making time to talk to me. At least with this diagnosis, I am having so much of the attention, care and concern has been given, otherwise which she had never experienced in her lifetime. So these comfort zone in the diagnosis can also makes the treatment difficult for the doctor. Until and unless she understands that, oh, this is a trap, this is not the comfort, this is a trap, I should come out from this vicious cycle. Unless and until she receives and she is willing to come out of that, no medicines, no doctor can take her out of that trap. She has to understand that she should never settle down in that comfort zone. Most of the people do that, like unknowingly. It is not their intention. It is not like, oh, I will do this only. Let me be in this diagnosis only so that I am getting attention. No. It is not like intentionally done. but subconsciously they are comfortable in that diagnosis, which gives us reason to relax, which gives us reason for the attention, care and comfort, and that is also a big obstacle in the journey of the healing. And for the doctor it is very difficult actually, because even if I say that, she will not be in the condition to understand because she is not doing it intentionally. But to make her understand that, come out of that comfort zones, don't settle down, try working, do something, put some effort and come out of that cycle, that takes more time than these medications and the therapy. Once we make sure that you are out of that, you are ready to come out of that comfort zone, then the treatment becomes much easier and duration of the treatment will be much shorter, because that saves a lot of effort of the doctor.
One small quick question. Is it that different foods will act differently in terms of constipating or not constipating me, or it will be like fairly universal that these foods are more constipating?
No, it's always individual specific.
So we have to also find out which food combinations and foods are
Definitely.
constipating or not constipating.
Yes, with which food, in which emotion, and on the days without suppression of the natural urges.
So how will the doctor? Okay, so then there's no nutritionist who can draw out the plan.
That's why even with the lakhs and lakhs of the nutritionist in the market, we see more number of the patients.
So then when you're talking about the ahara on Monday, you will have to also cover.
That's why I never love to give, that's why I would never give you a chart. Like if you have asked my previous patients, I will never give them a chart like, okay, 7:30 eat this, 8:30 eat this, 10:30 eat this. I will never give the chart like that, because it's always individual specific, season specific and your emotion specific. There are many days when you have to plan your food according to your emotions. There are many days your food has to change according to the climate, according to the season, according to the geographical area where you are going in. You cannot be eating the same food in the northern hemisphere and in the other part of the country. No.
And the availability. Seasonal.
That's what.
Fruits
The
and
food,
vegetables are always seasonal.
the food has to be decided based on so many factors. It is one diet chart. If you think that it can heal you, definitely not possible. Not possible. We can give you a range. We can give you the idea, like on the principles with which you have to choose your food based on the availability, based on the geographical area where you may be visiting. You can have a range of options, and in that you can choose. But sticking to one chart and following it every day will not be the answer, for sure. That is for sure.
Can I add a spiritual aspect to this? Actually, I had heard one of the gurus talking about this. If you actually, every time before you, so there is this Ayurveda which we basically breathe in and then breathe out to see which one is blocked. So if there is heat or there is cold, we adapt to that and eat. And there is one more step beyond they go, and they say if you just allow a few minutes before you eat, allow your body, just let it sit down, it will actually tell you what you have to eat, what is best for the body.
Yeah, but now tell me, how many people have this much time and clarity of the vision to understand what your mind is telling? Even after I tell everything with my mouth, they cannot understand and they cannot follow. And do you think that they will sit and they will visualize and they will listen to their mind? If they are doing that way, then they will never become a patient. So all these things are, yes, right, you are right. This is for a healthy individual to maintain his health, but not for a person who is already in some diagnosis. Definitely not. Anything else related to constipation? I think it's done almost. How much?
Exactly 59 minutes.
59 minutes. We'll conclude this topic of the constipation. If you still have any questions, we can discuss tomorrow, and we will jump down to next question now. Okay, please switch off. I want to ask, what do you want, Madhu?